Hi guys, today we'll be discussing on counseling HIV. A woman comes to the clinic with her child who has HIV. We have to counsel the woman. So let's counsel. Following gather. Counseling a woman with HIV about her child's diagnosis. So let's go. Good morning, ma. I'm Biabo Jaswi. I'm a candidate of this exam. I've been asked my examiner to counsel you. Can I go, ma? Thank you very much, ma. Are you comfortable with my language? Are you comfortable with the environment? Okay, thank you very much. Can I sit at your eye level? Thank you very much, ma. And please, who is this child to you? Your son. Okay, thank you. Please, what do you know about your son's diagnosis or about your son's condition? Please, where did you get that information from? Thank you very much, ma. So, from history taking and from physical examination, it is most likely that your child has what we refer to as HIV. HIV simply means human immune deficiency virus. It's actually a virus that actually enter into the child's body or a human's body and reduce the soldiers that are supposed to be fighting for that child. Each of us have soldiers that are supposed to be fighting for us. When these soldiers are reduced, any infection that are not supposed to be affecting us can now be affecting us because what's supposed to be fighting for us are no longer there. How can a small child actually get HIV? A child can get HIV simply from one, mother to child transmission during pregnancy or during labor. These are periods when the child can have what now? HIV. Also, a child can also have HIV when the child uses maybe a sharp object that somebody that have HIV has already used, or even from blood transfusion. These are different ways a child can come up with HIV. A child that has HIV, what will the child show to show that this child actually has HIV? The child will present with things like one, fever, high temperature all the time. The child may also have rash all over his body that are not going. There will become small, small swellings in places like under his neck, in his armpit. These small, small swellings are like little stones. Those things, we call them generalized lymphadenopathy, may be found in a child that has HIV. There are some tests we can do to be certain that your child has HIV. We can do what we refer to as the CD4 counts. We are going to check those soldiers. Are they much in the body or the HIV has reduced them? Also, other tests we can do include things like the viral load to check the amount of HIV within your child's body. That will even help us know that your child has HIV. Also, we can do what we refer to as Mantox tests. These are different tests we can do to be sure that this is actually HIV presentation. Now, for somebody that have HIV, some drugs can be given. These drugs that are given will actually help a lot. We refer to them as antiretroviral drugs. They fight against HIV. They reduce the viruses that are found in the blood. That's what these drugs actually do. However, these drugs must be taken for life. They are not drugs that you actually take a little and relax. No, when you take antiretroviral drugs, they are drugs that must be taken for life. You don't stop them, you don't change them. You get, you come to the hospital when you have any complaint about a drug, don't change, you must adhere to them. Also, it must also be a continuous thing. You don't stop it and you continue to come to the hospital because of this condition. You get to collect these drugs more. So you don't just relax and say I'm feeling better and then relax. No, because if you should relax, the HIV will move from one stage to another. And once HIV have moved from stage 1 to stage 2, stage 3 to, you cannot bring it back. You get, so HIV and AIDS is not something that should be played with. You get now, when your child start taking this drug, there may be some complications. Some things may start to happen that you say, I don't know, I've not given this child this drug. So we, when something like that happens, don't stop the drug. Bring the child to the hospital and we treat those conditions. There's a reason why it happened. Yes. If, for example, you are not taking the drug and you are seeing that your child is now becoming more sick, bring the child to the hospital and we are going to solve that issue. Do you get now? Don't stop the drugs because of that. The drugs must be continued. Then you should also know that since one of your child has HIV, it is possible that any other person in the family may have. So it is good you screen other members of your family and not just this child. Do you understand what I have said so far, ma? Thank you very much. Do you have any question? Okay, thank you very much. So I'm going to give you this flyer. This flyer I'm going to give you actually we tell you when next to come. But if there's any complaint before then, you can come. Can you recap what I've said? All right. Thank you very much, man. I really appreciate your time. Thank you. So that's how you counsel HIV.